All right, good afternoon, everybody. I hope you had a good weekend. Here with Josh and Paul and Dr. John Murphy, who maybe you remember is the CEO of New Vance Hospital. And that includes Danbury. That includes Norwalk hospitals, where we do have a red alert warning, as well as some hospitals elsewhere in the state and New York. So he gives us a lot of perspective in terms of what's going on last time and now this time in terms of hospitalization. Let me talk first about our 3 days of numbers. You can see we've got a lot of cases, 2,000 plus cases, but that's against 92,000 tests. So we're testing at an all-time high right now. So the positivity rate is 2.2%. So that's, we're about 2.4 for the week, I think. So that's a little less, but, and I'm just really glad to see it didn't spike up a lot over the weekend. But hospitalizations continue to go up, a concerning trend, 37 over the last few days. Dr. Murphy will talk about a little bit what that means. And fatalities, 12 more Connecticut souls no longer with us. The next chart. I wanted to talk a little bit about the European example, because Europe's been a bit the canary in the coal mine for us in the sense that they tend to be 2 or 3 weeks ahead of us on the curve. You remember we spent a lot of time in the spring looking at what was going on in Italy, and a little more comparable to our situation than, say, China. And a couple of things here are interesting. You can see how fast things have spiked in Europe over the last month or two. France, which is the red line, that's the one that's gone up the most. They have a positivity rate of about 10% compared to our 2.4%. UK, Spain, and Germany a little better off, and we'll be able to talk about that in a minute. Germany a little better off because they are much stricter when it comes to wearing the masks, I might add as well. But even France with a 10% positivity rate, compare that to, say, South Dakota and Wyoming, which have a 30 or 40% positivity rate. But on a broad basis, you can get an idea of what's going on in Europe, and now how are they responding? And that's what the next chart will show you. The next chart is the European restrictions, and they've done things similar to us and different from us. But I think it's most interesting is they're doing everything they can to avoid real lockdowns by increasing the restrictions as best they can. That top little tab you can see is curfews with the small clock there. And curfews is not something used as much in this country, used a fair amount in Europe, where they are, Italy, they've kept the bars or cafes or open, which we have been less likely to do, which we have not done in Connecticut, less likely to do in the United States, but they're closed at 6. Even in Paris, the city of lights, there the cafes have to close at 9 p.m. So they have been fairly strict about curfews as one way to try and limit the spread. Our strategy has been different, but they tend to do that on a regional basis as well. So Paris and 5 other French municipalities, not the entire country, are under that restriction. The lockdowns are much more limited, I think for reasons I implied before. They've tried even to limit things in Italy, and there have been really severe riots in Rome and a couple of other cities. So let's say people are exhausted and not looking for that. But in Ireland, they're at a stay safe, stay at home order right now. You can see over there in England, you've got Wales, for example, where they're being very restrictive in Wales because of the higher infection rate there compared to the rest of England. And they are stopping cars at the border, being very strict about stay safe, stay home. But you see around the rest of Europe, they've been a little more reluctant in terms of lockdowns. Online learning. There, Europe more or less is one have said, look, we're going to leave that up to the local jurisdictions, but they're keeping K through 8 open as much as they can and moving more and more of the high schools to online learning, for example, in Italy, based upon what the infection rate might be in a specific region. Not totally dissimilar from what our thinking is here in Connecticut. Gathering restrictions, they've been strict. They're saying no more than, say, 6 can gather in a private home or in a public space in a number of these countries, which maybe you can see if you've passed the eye exam. Sports are suspended in a number of places, including parts of Italy again. These are high school sports. We can talk a little bit about what's going on in our region. As you know, hockey has been shut down in Boston for 2 weeks, but the rest of our sports are going. There's a lot of questions about how much sports they'll be allowed on a regional basis in terms of tournaments and the such. But they've been fairly strict about suspending sports, at least at the school level. Bars and restaurant restrictions I referred to before in terms of not shutting them down, but in terms of the curfews again, and then movement restrictions. Again, they're hesitant to have a lot of people going back and forth across borders with similar guidance to what we have here in Connecticut. Basically, what you see are those restrictions. They're trying to enforce those seriously, doing what they can to constrain the expansion of COVID in Europe and avoid any further lockdowns. The next chart is just a brief reminder of what we're trying to do here in Connecticut, which is, again, through strict enforcement of our current guidelines, that's how we can keep our economy open. Here's a headline, I think many of you saw it. Fairfield pub shut down after violating state COVID-19 orders. They willfully went out of their way. Apparently they were pulling down the shades so you couldn't see the hundreds or dozens of people there not wearing a mask, belling up to the bar. There have been a couple of other incidents maybe you've heard about around the rest of the state right now. And if this keeps going, you're going to ruin it for all the restaurants and everybody who's following the protocols really seriously, just so we can stay open and do that as best we can. You know, Josh reminds me that hats off to the Public Health Department in, say, Fairfield and a number of these other places. They've been strict. They've come in. They enforced the rule when it came to this pub. They exacted fines and let that serve as a warning that we're going to be serious about enforcing these protocols, especially at these, bars masquerading as restaurants because of the incredible risks there are there. And what that does to jeopardize the infection rate throughout their community. A little like sports, please be careful as you execute these sports. You do your sports. Make sure that all the events in and around sports, the travel there, if there's some stay, because that, again, can spike up the infection rate and jeopardize your schools. This next chart is sort of just my way of introducing Dr. Murphy. It's the hospitalizations by state. And I think you can see the national average is about 14 per 100,000. I can see on that chart, Connecticut's in yellow. We're at about 6.5 per 100,000. Hospitalizations are important because early on in the pandemic, when we were talking about flattening the curve, we were really worried about overwhelming our hospital beds, overwhelming our ICUs. We're beginning to pay attention to this now in parts of Europe, like the Netherlands and Belgium. They are overwhelmed, and they're beginning to share hospital beds in Germany, for example, as they share just like we did here in Connecticut. You know, this chart is of interest. You can see Vermont, New Hampshire, Maine. They are at the very end in terms of the lowest hospitalization per 100,000. Think of them as a region. You can see for us there in yellow, we're right next to New York, a little higher than New York, which Andrew Cuomo will probably be quick to remind me, a little less than Massachusetts. Rhode Island is a bit the outlier. I don't know if you can see that, but they're just a little above the national average. And finally, at the other end of the chart where you have much higher hospitalizations, that's North Dakota, South Dakota, Minnesota, you can see there that they as a region have spiked up dramatically as measured by hospitalizations. But Dr. Murphy will point out that I think hospitalizations in October are very different than what we saw back in April and May, and I think he has some good news to share on that front. Dr. Murphy?
Yeah, thanks, Governor. I do think you're right. The setting is different today than it was 5 or 6 months ago when we faced an outbreak in the spring. A couple of key observations I think are worth sharing. The first of which is when we talk about the positivity rate and the number of individuals who are testing positive in our community, I think it's important to realize that the age of those who are now testing positive is different than it was in March, April, and May. For instance, in those earlier months, the percentage of individuals testing positive who were under the age of 18 was 4%. Now it's fully a quarter of everybody who tests positive are young people under the age of 18. So they're healthier. There are fewer comorbidities. They're much less likely to get sick. And of those individuals who do come into the emergency department, we're finding that we are much more comfortable sending individuals home, and if necessary, with home care nurses looking after them. So that when you realize of the individuals who are now in the hospital with COVID, and unfortunately we are still seeing hospitalized individuals, as you showed in your graph just a moment ago, we have just under 300 patients across the state who are hospitalized. But on average, those patients are anywhere from 5 to 10 years younger. Depends on whether you're looking at New York or Connecticut, but on average, it's about 5 to 10 years younger. And what that means is there are fewer comorbidities. Another important difference, I think, now, even when you do get sick, what is very different now than was, say, in March and April, is many more individuals are wearing masks. And it's pretty clear, and there's ample evidence now, that wearing a mask actually, even if you are going to get sick, it is likely you get less severely ill because the size of the viral exposure is significantly reduced by wearing a mask. I think the other thing that's different about this surge than the one that occurred in the springtime is that, we knew it was coming, and through the efforts of lots of people, vulnerable populations are much better protected than they were back then. We know who's at highest risk, and we have active testing surveillance in place to look at those who either live in or work in nursing homes, assisted living facilities, jails and prisons, et cetera. In addition to that, once you get into a hospital, if you do get into a hospital, we are better prepared, we have experienced staff, and the therapies actually are much more effective. To the extent that the press is interested in what they are, although you've heard many of them, I'm sure, the fact of the matter is that the mortality has fallen for us anyway, and I think this is true for most health systems across the state and in New York. From what was close to 22 to 23%, we're now down in high single digits with a mortality rate of somewhere between 8 and 9%. But importantly, with respect to the capacity of hospitals to handle this surge, the length of stay is down from a peak in June, at least in our health system, and across our 7 hospitals. We were just over 14 days. So the average patient who was admitted in May and June stayed for just about 2 weeks. Over the last 2 months, that length of stay is now under a week, just under 7 days, which effectively doubles our capacity. I would also share with you that fewer patients are ending up in the ICU because we are much better prepared to postpone or delay mechanical ventilation until it's absolutely necessary, and we're providing oxygen through different techniques. We're also anticoagulating patients much earlier in the illness using dexamethasone, et cetera, and reducing mortality and ICU stays. I think another important notion to keep in mind as we confront this surge is that we are much more aggressive about getting out in front of this. We are about to launch a trial for outpatient remdesivir, and we have 2 trials going on right now where we are using convalescent plasma in patients who have been exposed and are asymptomatic, and another trial for those who are testing positive with just a single symptom. We are trying very hard to prevent illness. Our testing and tracing is much better. The data is shared widely between the state and local municipalities and providers. And I think the degree of cooperation and collaboration is really light years ahead of where it was in the early days of the pandemic. So for all of those reasons, while we expect it to be a tough winter, we do not believe that we are going to be overwhelmed by this. And we are hopeful that our capacity is sufficient to meet the needs of our state in the coming months. And with that, I'll turn it back to you, Governor.
Hey, thank you, John. A sober demeanor and a hopeful message. I appreciate that. John's here to answer any further questions you may have, as well as Paul and Josh. Over to you, Max.
News 8.
Good afternoon, everyone. First, for Doctor, there many things that you listed there were certainly improvements from what we saw in the early days of the pandemic. So is it a combination of all of those things that leads you to believe now that moving forward, even though the number of people infected might be higher, we're in a much better position to care for them?
That's right. I do believe that we have better therapies. The patients who are coming into the hospital in large measure are a little younger and less likely to stay in as long and ultimately succumb to the illness. I don't want anybody to take away the sense that we are, overly confident or we're treating this casually. This is still a very serious infection, but I do believe that 7 months has taught us a great deal about how to combat it.
Governor, there was a report of an out-of-state situation where Dropbox ballot boxes, I guess one was burned and a lot of ballots were destroyed. How much is that a concern, and what steps have been taken really to have as many eyes on similar boxes as best you can?
Yeah, I hadn't heard about that particular incident, but I can tell you that we have hundreds, even thousands of volunteers who are going to be out there making sure people are social distancing, making sure that you can drop at the ballot box safely, and we'll be there to help the registrars and town clerks in terms of processing all the ballots. And we do have, state police on the ready if anybody is, creating any problems at any of these voting areas.
Also, as far as the people that do show up, and there are some do's and don'ts to what they are allowed to wear, are not allowed to wear, but you can't enforce, for the workers you can, but you can't enforce for those to come indoors to vote to wear a mask. I guess, is that frustrating? Because it's something that I think many people feel is necessary, but unfortunately with the rights of the voters, you can't really do much about it.
Yes, it is frustrating, but I talked to Secretary of State Denise Merrill. She has said, look, wear the mask. It's the safe thing to do. If you forgot your mask, we have a mask available to you. If for some philosophical reason you refuse to wear the mask, we'll get you the ballot outside or another way that you can vote without jeopardizing anybody else's health.
Thank you.
Channel 3 Eyewitness News.
Yes, Governor, we're hearing that law enforcement had conversations today with local health districts about possibly reverting back to phase 1. Is this something that's being discussed?
No, I haven't heard about that.
Okay, question about ice rinks. Massachusetts shut theirs down after an uptick in cases where hockey tournaments were being held. Are we seeing similar data here, and are we considering closing them down as well?
There are some incidents in and around sports, including hockey. There's no question about it. I believe the Yale varsity ice hockey team had a lot of infections there. As I've implied before, that most of it is not necessarily related to checking and skating on the ice. Most of it's related to all that happens before the game and after the game, especially when it comes to tournaments. So, to be blunt, we're talking to Massachusetts and New York and our neighbors about what to do about these tournaments. We'll have a judgment on that pretty soon, working with the leagues, by the way.
Yeah, and one thing that I would add to what the governor just said is it's very important for all constituents, including those within the hockey realm, to make sure they are participating in the contact tracing to make sure that we can limit any spread that can occur. But as the governor has stated, his team, including myself, have been in touch with our neighboring states just to understand what's going on in their states, but also to understand best practices as we have done throughout this whole crisis.
And Governor, final one from me. You made a lot of European comparisons today. Is there anything that you're looking to take from their playbook going forward into the fall and winter?
I think they're a 3-week head start on us. So, I learned a little bit about the nature of the hockey stick. It was interesting to me. Sweden, you maybe know, said, hey, let it rip. We're going to build up herd immunity. Everybody will be fine. Tell the old people to stay at home, and we're finding they have the same infection rate as most of the rest of Europe. So that's probably a strategy that was not that successful in hindsight. I'm sort of interested in how they're working on a regional basis and not doing everything state by state. We've had some of the same discussions. So to me, it's just interesting in terms of how we both look at these similar situations from similar and also different points of view.
NBC Connecticut.
Hi, Governor Matt Austin with NBC Connecticut. The Fed's just announced that they're sending 1 million of these Abbott Binax now on the rapid tests. Have you already decided where they're going to go?
Yeah, we've been getting our deliveries now for a couple of weeks. Right now, we're prioritizing universities and schools. Josh, you want to jump in?
Yeah, no, that's correct. We've received over 100,000 so far, and we've delivered a number of them to universities that are experiencing some outbreaks where we can rapidly test a whole floor of a dorm or a dorm to quickly identify cases. And we are working to pilot with a number of school districts for testing of students or teachers who develop symptoms to get rapid results to them. And we're looking to deploy them potentially into some of our rapid response testing where there are outbreaks in certain communities around the state. So it is a new technology. It's an antigen test, so it's got a different set of restrictions around how it can be used given from the FDA. So we're working with them and wrestling through some of the issues that other states are about the best ways to deploy those tests, but it's good to have them and another tool in our toolkit to fight COVID.
Thank you. And for Dr. Murphy, just going back to what you were saying about your expectations that it might be a tough winter, can you provide a little bit more color? What do you mean by that? What are the models suggesting to you, and how is the hospital preparing for that?
Sure. By tough winter, I want to remind everybody that I think this wave, we're at the beginning of it. We're not at the end of it. People, as the weather gets colder, are less likely to stay outdoors. I think with the holidays coming, there is a tendency for people to gather, potentially including out-of-state visitors, and sharing meals and holidays indoors. So for all of those reasons, I think that we have not yet seen the peak of this surge. In terms of models, we're actually working with the state leadership, including the Commissioner of Health and Josh. We have a call tomorrow to examine models. I've looked at 6 different models, both domestic and international models. And I would say that much like when you look at election polls, perhaps it's most useful to look at the aggregate of what those polls should or predicting. And while the 6 ones that I've looked at are varied about when we'll probably reach the peak, I think at the moment, the consensus is that it's probably not going to occur until mid-January.
Fox 61.
Good afternoon. Dr. Murphy, you talked about your COVID morbidity rates dropping from 22% to somewhere around 8 or 9% in your system, and you talked about more younger people becoming infected. My question is, for those people who traditionally have been at the higher risk, people of advanced age and with comorbidities, are their survival rates improving as well?
Yes, in general, that's true. I would say, though, that patients who are over the age of 80 and end up on a ventilator, the mortality really hasn't changed. It's still quite high. Our goal really is to try to prevent them from getting that sick by offering them therapies as soon after they're admitted as possible, whereas we and everybody else who was treating this 6 months ago had more of a sequential approach to introducing interventions. And we're now giving everybody a whole lot of medications as soon as they arrive to try to prevent that older patient with comorbidities ending up on a vent, because the mortality there is still too high.
All right. Thank you. And Governor, for you, we talked last week about students returning home from universities all over the country for Thanksgiving. And what complicates the issue is that many, if not most, universities are ending their fall term at Thanksgiving. Students are coming home. They will be taking their finals remotely. So for those students, staying at college through the Thanksgiving break is not an option. So I'm just wondering if you have some concrete guidance for families with students returning in terms of who should get tested and when, and in what combination with quarantining and so on. Just concrete guidance for these folks.
Yeah, Public Health will be issuing that guidance. Josh and Paul are dealing with our counterparts in our neighboring states right now. But, as a group, we're going to have tens of thousands of kids coming back from colleges all over the country. Some of them, maybe somebody goes to the University of North Dakota, South Dakota, Wisconsin, Idaho, Nevada. These are all places that have infection rates that are, 5-10 times ours. So, first of all, based on our basic travel advisory rules, test before you get on that plane, or in quarantine when you get here, or quarantine early and then test. We're going to give you clear guidance on what to do. I don't want people just getting on that plane, going home, potentially putting their family at risk and their friends at risk. So I think we're going to be reaching out to all the universities to reinforce this with the students, what they have to do before they get on that plane and what they have to do once they get to Connecticut.
All right, thank you.
News 12 Connecticut.
Governor, can you talk a little bit more? Are you looking at just enforcing the regulations surrounding these restaurants that are more like bars, or are you actually looking at new regulations?
Right now, I'm talking about enforcing the rules we got right now. Hats off to our local public health and municipal officials. They're taking this seriously. As you know, they have the right to fine. They have the right to shut these facilities down, at least until they make corrective measures. And I'm hopeful that strict enforcement, I'd like to see the restaurant association say, hey, come on, team, we're going to ruin this for everybody if we can't take care of ourselves. So I think that's our guidance for the near term.
Do you think that a closure should be longer than a couple of days to sort of put a little bit more power behind that penalty?
Yeah, we're looking at that.
Thank you.
WTIC 1080 News.
Dr. Murphy, could you expand a little bit on remdesivir? What's going on with that?
Sure. Remdesivir is an antiviral agent. And while it has not been demonstrably shown to reduce mortality, the data suggests that it does inhibit the virus from replicating to a certain extent, and that its effects are probably more pronounced if given early. And it has been shown thus far to significantly reduce the length of stay in hospitals. What we're trying to do now is, as I mentioned just a moment ago, in addition to using it early in hospitalized patients, we are trying to, we will soon start a study that even if you show up in the emergency department and you don't need to be hospitalized, we send you home, but we first give you remdesivir in the hopes that we can shorten and reduce the intensity of the viral illness.
And thank you. Paul, you shuddered a little bit when phase 1 was mentioned. What is the next step for some of these red areas now that we have a bunch?
Well, I would say one of the immediate next steps is making the decision of whether or not to exercise their right to go back to phase 2. The right after that, you working with your local health directors, working with DPH to make sure you are getting the communications out to the people within your communities, telling them what is going on within their community directly, letting them know where testing is available, and making sure that people are making the right decisions. That's not only keeping them safe, their community safe, and the state safe. I think one of the great things about our alert system is letting every single person within the town in which they live in to understand what's really going on and making sure that they're making the right decisions to keep themselves safe, their family, their community, and their state. We're all in this together, so we got to keep it up. So let's keep it up, Connecticut.
In that vein, Hartford today asked residents not to do the traditional trick-or-treating thing. Is that the advice for everyone in the state?
Well, we're leaving that up to local municipalities, but Hartford is a red alert zone, and I think Mayor Broden probably made the right call there. Every mayor is going to make up their mind for themselves. I think you heard last week that, you know, in the governor's residence, we're going to lead by example there. As much as I love Halloween, this is not the year that we're going to do it at the residence.
Connecticut Public Media.
Good afternoon. After talking with some of the mayors in red zones, they said the contact tracing doesn't show it's related to increased capacity at restaurants or salons, and they're not going back to phase 2. So what other assistance can the state give these mayors in these red zones to make the adjustments to lower the spread?
I got most of that. The question is, what other discretion can we give the mayors outside of going from phase 3 back to phase 2 to help limit the spread? I think enforcement. That's what we talked about earlier on. And I'd like to see strict enforcement. Obviously, we leave that up to each mayor, municipality, public health department. But I think what we learned from the European example, what we're learning here is that you can have 1 or 2 super spreader events at some event or party or restaurant turned bar that can really turn a safe area into a COVID-infected area. And I think our mayors, and with support from public health, are going to be on the front line there. And we've had a number of meetings with them about all the different types of enforcement available to them. We'll see if they need more tools later.
The Associated Press.
Thank you. Good afternoon, everyone. Dr. Murphy, you mentioned that in mid-January we could see the models show that we could see a peak. What kind of numbers are we talking about, and how would these compare to the peak numbers we saw earlier this year?
They still would not approach, and again, I think we need to study the models in a little bit more detail because I don't know the assumptions that are embedded in them related specifically, for instance, to age as well as the availability of certain treatments. I mean, what the models do demonstrate is that the numbers are going up. Some models predict actually that we'll be through the worst of it in late November. Other models don't show us peaking until February. But the models, at least with respect to our view of it and the burden on hospitalizations, is the peak won't be as great. But I think in the coming weeks, we'll be able to examine those. And we're doing this in partnership with the state, Yale School of Public Health, the Connecticut Hospital Association. We're all putting our models together to refine the assumptions and to extrapolate those models to our communities and our state. And I think in the coming weeks, we'll have a much more granular look so that we can answer that question more precisely for you.
Yeah, I was going to ask, those numbers, those models, do they differ by region of the state, or is it going to be a statewide figure?
The models that I have been looking at anyway are U.S. models, and they are not state-specific thus far. So that's the work that we need to do. And again, the state is playing a very active role as are other health system leaders in trying to bring more precision to this modeling exercise.
And Sue, I think it's a good moment also to remind everyone in Connecticut that models are just that. They're models. What actually happens is dependent on how we all behave, right? And so the efforts that everyone makes to wear their masks, to keep their distance, to follow the guidelines, to do the enforcement the governor was talking about will have an enormous impact on what the actual experience that we have this winter is. And so, even as we look at the models and we look at different scenarios, and of course, as we've always done, we plan for the worst. Our goal is that everyone follows the rules, and therefore we can get through this with as few infections and hospitalizations and deaths as possible.
Just to underscore Josh's point, the paper that I reviewed this morning, which was really a distillation of the 6 models, the key point that the authors made was that by late February in the U.S., even if the worst model were to come true, if we could get 95% of the population to wear masks, we'd save 100,000 lives in this country.
Thank you for that. And Governor, is there anything new with the travel advisory? Have there been any changes?
As you know, we're not changing the broad travel advisory, which has 30-plus states on it. What we have done is reach the agreement with New Jersey, New York, and Connecticut, and we're trying to put together a similar arrangement with Rhode Island, Massachusetts, and Connecticut, sort of our contiguous states. It's not really enforceable to be able to stop people from driving back and forth. But when it comes to people flying into our region, those guidance and those quarantine rules stay in place.
And is there any talk of maybe using rapid tests? I think Governor Cuomo's been talking about that in New York for travelers.
Right now we have the PCR test, is my understanding, at Bradley Airport. If we looked at the Binax test, which is, as you know, is rapid because it doesn't have to go to a lab. We can get that solved right then and there. So right now we're husbanding the Binax test. It's quite valuable, focused on universities and schools and some other first responders, just to give them an immediate response.
Great. Thanks so much, everyone.
Thanks, Sue.
CT News Junkie.
Thanks, Max. Governor, I think I have a sense generally of what you mean when you say a bar masquerading as a restaurant. Was there any sort of specific do's and don'ts for restaurants? Because as I understand, they're allowed to serve alcohol, but what constitutes a bar masquerading as a restaurant rather than just a restaurant?
People hanging out around the bar, standing up, masks off, having drinking and not eating anything. To me, a restaurant is more careful about having people seated, more careful about, serving the meal, keeps them seated. You put on the mask whenever you get up to walk around, which keeps everybody else safe in that environment as well. So I see a real difference there, and I think the healthcare professionals see a real difference as well in terms of spread.
The Hartford Current.
Hey, everyone. This is Emily Brenly from The Current. First of all, can you hear me okay?
Sure.
Yes.
Okay. All right, great. Having some internet issues today, but we're going to push through it. So the first thing I wanted to ask about was on bars and restaurants. Can you just give me the definition for a restaurant under the reopening guidelines, and I guess also the definition of a bar?
One serves meals and you can have a drink. The other doesn't serve meals, and all you do is drink.
So does it have to be like full meal? Because it sounds like a bar serving appetizers or whatever doesn't count. So how are you differentiating the two?
As I tried to describe, I can tell you 3 chicken wings. Is that a meal or is that an appetizer? What I really care about is people sitting down and not congregating around a big crowd in a bar-like atmosphere. And I think people, intuitively understand the difference and why one environment is much safer than the other.
Okay. And I also want to ask you a bit, Governor, about, obviously our numbers are rising, and we heard Dr. Murphy just now say that we're probably at the beginning of the wave that we're seeing right now. And so this is round 2 for the state. And obviously in the first round, as you've said many times, you're building the plane as you're flying and kind of figuring out what to do. This second time around, are you planning to do anything differently? Would you like to close schools and businesses earlier as we're seeing these numbers rise? What's going to be different this time around?
First time around, when the hockey stick was going up, it was so fast and the virus was just marching right down I-95 and 91. We worked on a statewide basis. I think the biggest difference now is we think we have early detection is much better, as Dr. Murphy was saying before. We've got more capacity, so I think we're able to deal with this more on a town-by-town or regional basis. In New York, they call it, I think, micro-clusters or something as opposed to statewide. If we had to do something more severe later on, we'd probably do that on a regional basis, not just a state basis.
And given what you know from, living through the first wave and that big peak in the spring, at what point will you start rolling back, reopening, closing schools, reinstating stricter guidance? Like, when does that happen?
I think what you've seen in Norwich and Danbury, when they get that infection rate up around 6-7%, there I think they appropriately took the lead, and they started rolling back in-person education and going just to a virtual. I think you're going to see, as the infection rates creep up and the positivity per 100,000 does the same, in and around 15, 20, I think you'll see a lot more towns taking a more stricter reaction in terms of what we've got to do. In the meantime, what I really want to focus on, Emily, is enforcement, because I think you're finding it's the old 80-20 rule in this case, probably 5% creates 95% of the infections. It's those super spreader events, and they are avoidable. And as you heard, in the meantime, for the rest of us, if you wear the mask, we really do know a lot more about how we can contain this virus today than we did 7 months ago.
And I hear you on towns closing schools and things, but when will the state start, rolling back some of these reopenings, consider closing schools, consider taking steps back toward phase 2 and phase 1 on a statewide level from your office?
That's not anticipated at this point. I can't give you an absolute fail-safe number of 25 per 100,000, and this is what we do, because the circumstance could be how fast it's happening, where it's happening, how different it is one part of the state to another. And I think we've learned over the last 8 months that we really can target our response. So I think it gives us a lot more flexibility than we had back in the spring.
I'm sorry, I just want to clarify here. So you're saying that right now you're not planning on closing again statewide at all, throughout this wave that we're going through?
No, I don't think I said that, but I said I certainly don't anticipate it at this point, that we have much better ability to target our response than we had back in April. And I think even though I've seen some really strict hockey sticks here in Connecticut, we've gone from 1 to 2 to 2.5% over a period of time. We haven't been localized, but I think you see it in regions. So I think we're going to still focus on that strategy.
Thank you.
Hearst, Connecticut Media.
Hi, Governor. Can you hear me okay?
Sure.
Great. Thanks. So my question is, the mayor of Norwalk said that he wished the state would provide more guidance instead of leaving it up to just the locals. So where do you fall on that? Do you think the state needs to give more guidance, or are you leaving it up to the locals to really decide?
I think we've got a pretty good balance out there. Half the people are saying no one size fits all for the entire state, and others are saying give me more strict guidance or tell me what to do. I think given where we are in the pandemic right now, giving our mayors, first selectmen, that discretion, but giving them strong guidance in terms of where we think they ought to end up is the right place to be. As I mentioned to Emily earlier, if we see things ramp up and change in a significant way, we'll have to be more directive. But I don't think we're close to that right now.
And then in terms of, because you've talked about enforcement a lot tonight, in terms of enforcement, do you see the state having a role in giving more resources towards enforcement in terms of these bars and restaurants that we've been seeing?
Well, first of all, on resources, as you probably know, we got, I think it was a couple $1 million out to our local departments of public health. I mean, these guys have been heroes. They're incredible. A lot of us weren't quite sure what they did a year ago. We sure as heck know now. Not only are they doing enforcement, but they're doing track and trace, and they're going to be very involved when the vaccines start rolling out as well. So I think we're doing that. In the meantime, we met with all of them. We're meeting with municipal officials in terms of guidance, in terms of enforcement and other things they can be doing at the local level, so we're all speaking with one voice.
Thanks. And then also on hockey, you sort of indicated that there would be some guidance coming soon. Can you give us a sense of what that would be?
What's your sense on that, Paul, about hockey?
Yeah. First and foremost, everything is driven by data. So we're getting data from the Department of Public Health, who have surveyed local health directors within the state of Connecticut. Second, we're going to be having conversations that are actually happening right now as I speak with health leaders from across New England, led by Massachusetts and Governor Baker's office, who requested this meeting to talk strictly about hockey and the spread, particularly focusing on travel from one state to another for hockey-related tournaments. So with that, in addition to that, we are also having our usual conversations with the CIAC, who should be looking to put out their guidance for winter sports in the coming weeks. But at least in the immediate time frame, we're going to be focused on how we can potentially limit the travel for these various tournaments, particularly dealing with not only the closures of hockey rinks that are happening not only in Massachusetts but also in New Hampshire, but particularly to limit the spread that we have seen, particularly within hockey and hockey-related activities.
Thank you.
The Connecticut Mirror.
The White House Chief of Staff over the weekend said the administration is really not focused anymore on stopping the spread of COVID, but is looking at development of more therapies as well as a vaccine. Quite frankly, how counterproductive is that for the message that you all are trying to deliver here today?
It's not helpful. We have said, I think, unanimously that our behavior, wearing the mask and following those guidance can make an enormous difference in terms of limiting the spread of COVID. So I don't like the tone from the Chief of Staff. He thinks we can't do much about this and let's wait for a silver bullet. In some point, the therapies and the vaccine will really be readily available. We're not going to let our people get infected in the meantime. As you've heard from everybody, what we do, we can take control of our own destiny.
Dr. Murphy, would you address that?
Yeah, I agree completely with Governor Lamont. I think it's terrific that, a year after within a year of the virus first, being identified, we're actually talking about a vaccine. That's remarkable. It took us 15 years to get a vaccine for Ebola and 60 years for us to get a vaccine for polio. Here we are within 10 or 11 months talking about a vaccine. So I think it's terrific that we are moving forward with testing 6 different vaccines in phase 3 trials. But I think it's absolutely incumbent upon us to keep the population as safe as possible, avoid as many deaths as possible and as much morbidity as possible while that vaccine works its way through trials and ultimately comes to market and is available for distribution.
Dr. Gottlieb, who advises the governor on reopening, said over the weekend that, he does not see any federal intervention coming, so it's all on us as a community. My question to you, Doctor, is there any additional specific public health guidance you would like to see from government officials? And I'm thinking in terms of, is there better advice that should come out on, for example, the different types of masks? You said something interesting earlier about
the wearing of masks could reduce the exposure to, could reduce the viral load that a wearer is exposed to, so that even if you get COVID, perhaps it's a more milder version of it. So is there anything else in terms of specific guidance for the community as a whole that you'd like to see?
Well, I would first commend the state for its active and ongoing outreach and partnership with health system leaders and the Hospital Association. The public health team is meeting with us every week to hear our thoughts, share ideas, brainstorm, and we learn from them, and the reverse is probably true as well. I do think that, the answers that the governor gave a moment ago are absolutely correct. We need to keep working on how better to treat this once people get infected. We are also trying very hard to prevent people who are exposed to becoming ill. But the notion of a mask, it really does matter. The more we look at masks, the more we realize even cotton masks do, in fact, reduce both the spread from the wearer as well as protect the wearer from, as I said, the size of the viral exposure that he or she may get from someone who is a spreader nearby. So I think that the state is really doing a fine job in looking out across the country and, for that matter, the world, to see what others are doing and actively engaging those of us who are providing health care to be partners in the strategy. And it is an ongoing effort and one that we take very seriously.
My last question is for the governor. Governor, you seem to struggle at times to find a balance you want to strike on enforcement versus encouraging people to do the right thing. When you talk about giving municipal leaders discretion, how would you characterize your approach at this point as to what is the most effective way of getting people to do the right thing?
By convincing them that it's the right thing to do for themselves, their family, their community, and beyond. As we've talked about this, I can't enforce my way to 100% of the people wearing the mask. I can't sit around finding people on every street corner. But we have one of the highest concentrations of people wearing the mask of any state in the country because people know it's the right thing to do, and it's made an enormous difference in terms of infection rates in our state. When I talk about enforcement, I'm thinking about those institutions, those establishments where I got to hold those few outliers accountable, like that pub.
Thank you all.
The Waterbury Republican American.
Thank you. Just want to clear something up. Governor, at the beginning, did you say that the 7-day average is 2.6% today, the positive test rate?
2.4, Paul.
2.4, yeah.
2.4. How does that compare with what we've been seeing lately or earlier?
It's continued to tick up over the last couple of weeks, as the governor mentioned. I think it's still the sixth lowest in the nation among the 50 states. Josh, or the governor,
are you hearing from the Department of Public Health and other advisors to the state, as Dr. Murphy said, to expect a surge in this latest I don't know what you want to call it, but by mid-January, is that what you're hearing?
Well, we're looking at the trends that we've been seeing over the last several weeks, and as mentioned, it's our job to plan, right, and to be prepared, and to be prepared for the more severe scenarios. So we have been throughout the summer, as we've talked about, right, been in active planning, and we have an incredibly robust testing infrastructure in place now. We've got a statewide modern contact tracing system in place. We've got a warehouse that's filled with PPE. We've got partnerships with the healthcare systems and the nursing homes that have a set of interventions in place that we didn't have before in the last wave. So, we definitely think we're far better prepared today, in addition to all the clinical improvements that Dr. Murphy described. But that said, no one can forecast with certainty what the future will hold. So we're in active preparation mode.
But are you hearing the same thing mid-January?
We're looking at the models as Dr. Murphy described. The one thing you can be certain of with models is that they're all wrong. So we're just looking at all the different scenarios and anticipating what could come and planning accordingly.
Okay. And do you guys know if any of the new additions to the red alert list have informed the Department of Economic and Community Development today that they will be rolling back to phase 2?
We will get a final word on that. Those towns have until 6 o'clock today. Correct? Am I correct, Josh? Yeah, 6 o'clock today.
And so far, we haven't heard from anyone who elected to roll back.
Okay. And Josh, you mentioned a pilot program for the Binax testing system for public schools. Could you elaborate a little bit on that?
Sure. So the Binax is extremely effective in terms of delivering a rapid result for people, particularly who have symptoms or who are in an environment where it's very likely that they've been exposed to COVID. So we are working with a number of school districts around the state to help train them on how to use the test, or with their local healthcare partners, whether those are federally qualified health centers or their school-based testing, to have the training that they need. They need to be able to report the data back to DPH if they're going to take the tests. But we're working to get those out in the field so that the example would be is if you've got someone who's symptomatic in a class, if we can turn around a rapid test result, it may save them from having to close the class or close a school for a day or two while they wait for those confirmatory test results. So we think that could be a useful application in our schools, and we're excited about the partnerships that we're forging, and should have more to communicate about that in the coming days and weeks.
Okay, I was just about to ask that. So no announcement imminent right now on this pilot program for the local school site. Okay. All right. I guess that does it for me. Thank you very much.
I learned a couple of things. Listening to Dr. Murphy's sage advice, we always knew there was going to be a second wave. We knew this from 1918. We knew this from our healthcare advisory group. We're hoping maybe end of November, end of December. And I think John Murphy's reminded us some of the models could take it into the new year, and that it will get worse before it gets better. That's the sobering news. But you also heard from Josh how much better prepared our state and our country is today compared to where we were 7 or 8 months ago. You heard from Dr. Murphy in terms of how we can reduce the stay in hospitals by more than half, and the fatality rate has gone way down. And reducing the stay by more than half increases our capacity, so we're much better in a hospitalization point of view. Paz's question about Mark Meadows and don't worry, the therapy is going to be here to save us. We are going to rely upon therapies. We are going to rely upon a vaccine. And sometime, according to the models, that's going to be available. But in the meantime, this works. That's what I heard today. Thank you, everybody.